then in the spleen में 10 to 28 weeks पे, and then in the bone marrow that is 18 weeks to adult. So yolk sac पे is the basic training camp, and it is where our early red blood cells are first formed. Then liver, as the cells become more specialized, they head to the liver for more advanced training, and young liver becomes a hub for the blood cell synthesis. Then your spleen at 10 to 28 weeks, now our blood cells are getting pretty good at their job, and they spend some of the time in spleen that will act as the refining school. And bone marrow is 18 weeks to adult, and finally our red blood cells graduate to the bone marrow, where they reach their full potential and continue to be produced throughout our lives. Okay, now see this mnemonic: young liver synthesizes blood. That is how you can remember the fetal erythropoiesis कहाँ होती है and at what time. Okay, so yolk sac, then liver, then spleen, and then bone marrow. Now let's talk about the stars of the show, that is the hemoglobin. So in embryonic stage we have two main types of hemoglobin, that is your embryonic globins, fetal hemoglobin, and your adult hemoglobin. Okay, so the embryonic globins are made up of your eta and your this one I exactly don't know what this is called. So these are the two chains present in the embryonic globins, and they are the starting versions. Okay, and this is your embryonic globins. Then comes your fetal hemoglobin. Fetal hemoglobin is made up of alpha 2, gamma 2. Okay, alpha 2, gamma 2 is your fetal hemoglobin. Then comes your adult hemoglobin. Adult hemoglobin में HbA1 is made up of alpha 2, beta 2. Okay, and HbF has the fetal hemoglobin alpha 2, gamma 2. HbF is essential during the fetal life because it has a unique superpower. What unique superpower it has? It has higher affinity to oxygen as compared to the adult hemoglobin, and this allows it to snatch the oxygen from the maternal hemoglobin, that is crucial for growing baby across the placenta. Then we have adult hemoglobin. Adult hemoglobin is HbA1 made up of alpha 2, beta 2. Now as we grow and mature, the fetal hemoglobin will gradually fade away and HbA1 जो है वो बढ़ जाएगा, and this is the hemoglobin most of us have in our body as adults. Okay, and there is another one, that is another hero, HbA2. What is HbA2? HbA2 consists of alpha 2 delta 2, alpha 2 delta 2, and it exists in small amounts. Okay, it is also a form of adult hemoglobin. So from fetal to adult hemoglobin, alpha always, मतलब अल्फा तो रहेगा ही, fetal hemoglobin में भी है, adult hemoglobin में भी है, but gamma will go and it will become beta. Remember that. Okay, now this diagram, let's just see the diagram. ये देखो, site of erythropoiesis देख लो. Site of erythropoiesis पहले yolk sac होती है till 6 weeks, then it becomes liver from birth to 6 weeks, and then spleen is there at 10 to 18 weeks, and finally your bone marrow is there. Okay, in the postnatal months after birth, bone marrow is the main site of hematopoiesis. This one, let's see this chart. This is your eta, and your these two chains are responsible for your embryonic globins. ठीक है, और फिर तुम्हारी आती है just see the fetal hemoglobin. Fetal hemoglobin में अल्फा तो कांस्टेंट रह रहा है adult life में भी, but then this is decreasing, that is your this one. Okay, this is gamma is decreasing and becoming what? Becoming beta. Okay, so adult hemoglobin has beta and fetal hemoglobin has your gamma. So this is the chart. This is the image that I have tried to explain. Now let's just move on to the different blood groups. Blood groups